Hello friends, welcome to my channel. My name is Abhirami and I am here to talk about the ulnar nerve. So I will be talking about the introduction, origin, course, termination, branches, relations and clinical anatomy. So first let me talk about the introduction. The ulnar nerve is also called as the musician's nerve because it controls the fine movements of the fingers. And then the ulnar nerve supplies 1.5 muscles in the front of the forearm and 15 muscles in the palm. Now going to the origin of the ulnar nerve arises from the brachial plexus, from the medial cord of the brachial plexus. And the roots of the ulnar nerve is C7, C8 and T1. As you can see in this image, the ulnar nerve arises from the medial cord of the brachial plexus, and then going to the course of the ulnar nerve passes medial to the brachial artery. As you can see in this image, it passes medial to the brachial artery, and then at the level of insertion of coracobrachialis, it pierces the medial intermuscular septum to enter the posterior compartment of arm. And then in the posterior compartment of arm, it travels downwards, and at the region of elbow, it passes beneath the medial epicondyle and in between the two heads of the flexor carpi ulnaris to reach the front of the forearm. And then it travels through the front of the forearm and it reaches the wrist region. In the wrist region, it passes superficial to the flexor retinaculum through the ulnar carpal ligament. And then it divides into a superficial branch and a deep branch. The superficial branch is cutaneous, but the deep branch is passing through the hypothenar eminence, and then it ends in the adductor pollicis. The superficial branch supplies the muscle palmaris brevis, and it also gives digital branches to the medial 1.5 fingers. Now let's go to the relations of the ulnar nerve. So ulnar nerve in the elbow, it passes behind the medial epicondyle and in between the two heads of the flexor carpi ulnaris. And then in the forearm, it passes medial to the flexor digitorum profundus muscle. The ulnar nerve passes medial to the flexor digitorum profundus muscle in the forearm. And then it in the wrist region, the ulnar nerve passes superficial to the flexor retinaculum between the pisiform bone and the ulnar artery. So that is about the relations. And also the ulnar nerve divides into a superficial branch and a deep branch at the level of the flexor retinaculum. So after it divides into a superficial branch and a deep branch, the superficial branch supplies the medial 1.5 fingers, and then it also supplies the palmaris brevis muscle, whereas the deep branch, it will end in the adductor pollicis muscle. Now let's go to the branches of the ulnar nerve. So the ulnar nerve has muscular branches, articular branches, palmar cutaneous branches, dorsal cutaneous branches, and then a superficial branch and a deep branch. So muscular branches are to in the forearm, the muscular branches go to the flexor carpi ulnaris and the medial half of flexor digitorum profundus. And then going to the articular branches are given to the elbow joint. And then going to the palmar cutaneous branch, the palmar cutaneous branch arises in the middle of the ulnar nerve. In the middle of the forearm, the palmar cutaneous branch arises from the ulnar nerve in the middle of the forearm, and then it supplies the skin over the hypothenar eminence. And the dorsal cutaneous branch arises 7.5 centimeters away from the wrist in the ulnar nerve, and it goes to the dorsal part of the hand and it supplies the dorsal part of the hand. And then going to the superficial branch, the superficial branch is cutaneous, and the superficial branch supplies the palmaris brevis muscle and gives digital branches to the medial 1.5 fingers, whereas the deep branch will supply 3 muscles of the hypothenar eminence, and then 8 introchai muscles and 2 medial lumbricals, and then it will also supply the adductor pollicis muscle. It terminates in the adductor pollicis muscle. So the deep branch supplies 14 muscles in total, that is 3 muscles in the hypothenar eminence, and then 8 introchai muscles and 2 lumbricals on the medial side, 2 medial lumbricals, and also it supplies the adductor pollicis muscle. And the superficial branch supplies 1 muscle, that is palmaris brevis. So totally the ulnar nerve supplies 15 muscles in the palm and 1.5 muscle in the forearm. So what is that 1.5 muscle? It is the flexor carpi ulnaris and the medial half of the flexor digitorum profundus. So as you can see in this image, these are the branches. First there is a branch to the flexor carpi ulnaris, then a branch to the flexor digitorum profundus, to the medial half of the flexor digitorum profundus, and then there is the palmar cutaneous branch and the dorsal cutaneous branch, and then it divides into a superficial branch and a deep branch at the level of the flexor retinaculum. Now going to the clinical anatomy of the ulnar nerve. So the ulnar nerve commonly gets injured either in the wrist region or in the elbow region. So if the ulnar nerve gets injured in the elbow region, then the flexor digitorum profundus muscle and the flexor carpi ulnaris muscle get paralyzed. Because of that, the medial border of the forearm is flattened, and also the flexor carpi ulnaris muscle does not tighten on making a fist. And this is what happens when the ulnar nerve is injured at the elbow. If the ulnar nerve gets injured at the wrist joint, it is called as ulnar claw hand. So what happens is there is a extension of the metacarpophalangeal joints and then flexion of the interphalangeal joints. This happens only in the medial two fingers, that is the little finger and the ring finger. So there is extension at the metacarpophalangeal joints and flexion at the interphalangeal joints. Going to the sensory changes that take place because of ulnar nerve lesion at the wrist, there is a loss of sensation in the medial 1.5 digits in the palmar aspect. In the dorsal aspect, there is a loss of sensations in the medial half of the hand. So that is about the sensory loss. Then going to vasomotor changes. Because of loss of sympathetic stimulation, the medial part of the hand gets warmer because of arterial dilation, and also there is absence of sweating there. And if the ulnar claw hand remains for a long time, then it leads to dry scaly skin. So this is it about the ulnar nerve. Thank you for listening to me. If you like this video, please like, share, subscribe and comment on it. Thank you.